In this presentation, I'll try to cover the application and the interpretative information about the immunohistochemical technique. So let's start with the application of immunohistochemistry. Where do we apply this technique? We apply this technique for diagnostic purposes. What are the areas where we use it in diagnosis of immunohistochemistry? First is like for undifferentiated malignancies. The common primary panel which we use for any undifferentiated malignancy is the one which includes the marker for epithelial cell origin, for lymphomas, for melanomas. So the primary panel includes pancytokeratin, CD45 and S100. The other uses include for diagnosis of carcinoma of unknown primaries. For example, we'll be putting a panel on the tissue under question depending on what all areas do we suspect. So suppose we have a proven case of carcinoma in which pancytokeratin is positive. So what all markers you will put to determine the lineage? I'll be giving few examples of it, like for the breast, ER, estrogen receptor, progesterone receptor, HER2 receptor are put in the breast. For the prostate, we have prostate specific antigen, we have prostine. For the lung, we put TTF1. For the colon, CDX2, and likewise. Other uses, third use is for seeing whether invasion is present or not. And how do we determine that? By the presence or absence of basal cells, basal cell lining in prostatic carcinoma. So we'll put the markers for the basal cell and see whether they are present or not, because if they are present, then they are present in the normal glandular lining, while they are absent in the prostatic carcinoma. Presence or absence of myoepithelial cells, myoepithelial cells in breast carcinoma. So myoepithelial cell, they lines the ductal epithelium, but if they are absent, then it's a sign which goes in favor of breast carcinoma. And other uses, other diagnostic uses, for detection of micrometastasis. Micrometastasis is a phenomena which we often encounter in two common malignancies, that is breast carcinoma and melanoma. Other diagnostic use for detection of microorganisms. Microorganisms include viruses like HSV, CMV. We have toxoplasma also, for which we have antibodies. So in the diagnostic part, this is just a summary of the diagnostic application of the immunohistochemical technique. Then comes the second prognostic use of this technique. Prognostic use of this technique is made in like Ki67 proliferation marker to determine whether the tumor is having a high proliferative index or not, and other are like HER2. It's a poor prognostic marker in breast carcinoma, and CD38 is a poor marker in CLL, and other use prognostic theranostic or therapeutic use, which includes ERPR, estrogen and progesterone receptor, HER2 receptor in breast carcinoma. We have anti-HER2 drug Herceptin, and we have anti-ERPR drug tamoxifen used for treatment. So these are the applications of the immunohistochemical technique. Next we'll start with the location of the antigens. Where are these antigens located? Because location is something which helps in interpreting the antigen correctly. So what are the location of these antigens? What possible locations are there? Let me draw an hypothetical diagram. This is a cell, this is a nucleus. So an antigen may be located in the cytoplasm, an antigen may be located in the nucleus, or an antigen may be a combination of cytoplasm plus nuclear and membranous is the another location where an antigen may be located. So let's start with the cytoplasm. What all antigens may be will show cytoplasmic positivity. So all the intermediate filaments. What are intermediate filaments? Intermediate filaments are the filaments which form cytoskeletal framework. For example, in the epithelial cell we have cytokeratin. In the mesenchymal cell we have vimentin. In the glial cells we have glial fibrillary acid protein, GFAP. In the neurofilament, in the neuronal or neurons we have neurofilament protein, and in the muscle we have desmin. So all these will show cytoplasmic positivity. Another is melanosome associated protein. Melanosome associated proteins include melan A and HMB 45. They also show cytoplasmic positivity. And cytoplasmic proteins or the contractile proteins, which include actin, and secretory products. Secretory products like ACTH in the pituitary cells and trypsin in the pancreatic cells, they all show cytoplasmic positivity. Then comes the nucleus. what all enzymes are expressed, what all antigens are expressed in the nucleus, there are two important categories. One is the transcription factors, and the transcription factors include P63, P53, P40 and thyroid transcription factor 1, and we have PAX 2, PAX 8 and other include myogenin. These are all transcription factors. Myo D1. And hormonal receptors, steroid hormonal receptors are also present on the nucleus. So, ER, PR will also show nuclear positivity. Then comes combination of this cytoplasmic and nuclear positivity. One more thing which I forgot in the nucleus is Ki67. Ki67 is a proliferation marker which is expressed in the nucleus, but there is an exception to the rule. There is always an exception to the rule. So, do remember, this is a generalized concept whatever I am discussing here, but there are exceptions to them. So, the exception to the Ki67 positivity is its cytoplasmic or membranous positivity in hyalinizing trabecular variant of dash. This is your homework. I had given too much of hint. So, the combination of the cytoplasmic and nuclear positivity is seen in S100 calretinine, there is one peculiar thing about beta catenin. Beta catenin usually shows cytoplasmic positivity. It is its conversion to the nuclear positivity that is associated with APC adenomatous polyposis coli and other disorders which include this mechanism. Last but not the least is the membranous. So, what all antigens are located on the cell membrane? In the membranous category, we have the receptors which are located on the membrane, like EGFR, epidermal growth factor receptor, HER2 neu also comes, and we have cell adhesion molecules like E-cadherin. And all cluster of differentiation, be whatever be the number, all cluster of differentiation, they are expressed on the membrane. So, these are the examples showing their site of expression, but sometimes it is important that there is lack of expression. So, lack of expression of some markers is important. Let me just give you few examples. For example, the one E-cadherin I said. So, the loss of E-cadherin is a marker of lobular carcinoma of breast. Okay. Loss of DPC4 is a marker of pancreatic cancer. Any other example? Loss of INI1 in ATRTs or rhabdoid tumors.